everyone, Dr. Jeff here with you today. I've had a lot of questions this week on bursitis and tendinitises and what are they and what causes them, and well, they both end in An Itis, so that's kind of the same. They're both inflammatory conditions. A tendonitis comes from a tendon. A tendon is the end of your muscle, so it forms kind of a fibrous tissue that attaches onto the bone. It's very thick. It doesn't really contract. And what can happen with tendonitis is that overuse of that muscle, the tendon gets more and more inflamed. It's a repetitive type of strain, repetitive type of injury. It can be traumatic, where you fall on something, you damage the tendon, but generally it comes over time where something just gets a little sore, to the point it's really, really sore. Whereas a bursitis is a bursitis, and what a bursitis is, it's a little sac of fluid, and when a tendon runs over a bone or a tendon runs over another muscle, you have a little sac of fluid called a bursitis. And what can happen for some reason, it could be trauma, but it also be stress, or you've been sick, or we don't really understand why, but this bursitis can become very inflamed. It's like a balloon just blowing up, and it's a space-occupying lesion. When you have a tendonitis, usually it's one motion you're doing. So if it's in your shoulder, lifting your arm up might hurt, or reaching behind you might hurt, or if it's in your hip, it might be stepping forward, things like that. Whereas with a bursitis, it's a general movement, so any motion with your shoulder is sore, or any motion with your hip is sore with a bursitis. A bursitis is more of an older person type of thing, more commonly in your hip, your knee, and your shoulder. Bursitis can come on all of a sudden, and it can disappear all of a sudden. As far as treatment is concerned for tendonitis and bursitis as well, any action you're doing that irritates it, well, you should probably stop doing that. As far as a medical way of treating it is, they'll give you an anti-inflammatory, possibly a cortisone shot. They'll do icing. And of course, here it goes with a wellness center. The way we treat it is again treating with ice. We have something here called Traumeal, or a naturopathic anti-inflammatory with it. We'll do ultrasound, laser, some stim on it to try and get rid of it. I've seen bursitis come in where you got a sac of fluid kind of down here because they fell on their elbow playing hockey. A medical doctor might drain that with a needle. We put some stuff on to try and get that swelling out of it. Likewise, a Baker's cyst in the back of your knee is just a glorified bursitis as well. Both bursitis and tendonitis will be very painful at night, so they're very similar in that way. But treatment can be somewhat the same. We have to get the inflammation out. If you have any questions about bursitis or tendonitis, you can always email me at jgoldsworth@goldswills.com. You can talk to me on Facebook, or you can just come in and see me. I'm Dr. Jeff, and I've got your back.